All right, so the purpose of this presentation is to share the results of a project that we've been doing for the Vermont Children's Health Improvement Program about antibiotic stewardship in the pediatric population in Vermont. And I am going to be presenting with Maya Reblin. So what is antibiotic stewardship? So antibiotics can lead to the emergence of antibiotic resistance. So these are microbes that don't respond well to antibiotic treatment because they're resistant to the treatments that we have available. The CDC estimates that resistance leads to about 3 million infections and 35,000 deaths per year. So antibiotic stewardship is the practice of using antibiotics only when necessary and using the appropriate antibiotics dose and duration. And we'll post the links to this information. So this project, as I mentioned, is funded through the Vermont Children's Health Improvement Program, and the goal is to understand parental beliefs about antibiotics through a survey of Vermont parents, which I'll talk about, and a qualitative assessment of discussions on the Baby Center Parenting Forum, which Dr. Reblin will talk about. So just a little bit of background about a couple of different symptoms or diseases that sometimes get prescribed antibiotics, sometimes appropriately, sometimes not. So sore throat, antibiotics are recommended if sore throat is due to strep throat, which is a bacterial infection. And a strep A test is used to determine whether a sore throat is due to that bacterial infection rather than due to a virus. Some of the symptoms that might suggest that a strep A test is warranted include fever, pain when swallowing, sore throat that starts quickly or looks red or swollen tonsils, white patches or streaks on tonsils, red spots on the roof of the mouth, or swollen lymph nodes. And up to 30% of children with a sore throat have strep compared to about 10% of adults. And this information is available on the CDC website. Ear pain is another one that can sometimes be where antibiotics can sometimes be overprescribed. In general, for mild cases with symptoms on just one side for children 6 months to 24 months, or both sides if they're over 2 years, a lot of organizations such as the CDC recommend potentially thinking about watchful waiting rather than immediately prescribing antibiotics. And part of this reason is that 4 to 10% of children treated with antibiotics for acute otitis media experience adverse events. And this information is also on the CDC website. And then urinary tract infection, most are commonly caused by E. coli, about 85% of cases. A urinalysis is required for a definitive diagnosis, and they frequently require antibiotics. So with that sort of stage setting, I'll talk about our survey and some of the results. So we've partnered with the UVM Center for Rural Studies. Questions were asked as part of the Vermonter poll, which is a statewide poll that's conducted annually. And we used a screening question to identify parents with children 18 or younger. And in total, we had 128 responses. So the first question that we asked was, thinking back to the last time you were prescribed antibiotics for your child, did you finish the course of antibiotics? So an important part of antibiotic stewardship is completing a course of antibiotics if prescribed. So almost 84% said that they did. About 1% did not fill the prescription, around 7% started the prescription but did not finish it, and about 9% had not recently been prescribed antibiotics for their child. And then of those who said that they started but did not finish a course of antibiotics, about 2.3% of the total number of respondents said that the reason that they didn't finish the course was that symptoms improved or did not get worse. Nobody said that they didn't have time to finish the prescription. Around 1% said that they didn't have enough money to pay for the prescription. Around 1% said that they stopped due to side effects. Around 4% said that their children just didn't like taking the medicine. And we didn't have anybody say that they stopped for a different reason. And then we wanted to try to understand parental expectations around some of the symptoms that we were talking about. So we asked, when I take my child to the doctor, I expect a prescription for antibiotics when my child has, and then choose all that apply. We had relatively low rates for cough, runny nose, fever, or sinus pain. Just over a third said that they expected antibiotics for ear pain. A small number, 6.2%, expected antibiotics for the sore throat. Just over a third expected antibiotics for painful urination, and around half said none of the above. Then we asked, when I take my child to the doctor, I expect a medical test when my child has, and then choose all that apply. So few parents expected a medical test if their child had a cough, runny nose, fever, or sinus pain. Around a third expected a medical test if their child had ear pain. More than a third expected a test if their child had sore throat, which might be appropriate if it's potentially that strep A. And just over half expected a medical test if their child had painful urination. And in general, parents reported that they trust their doctor when their child is sick. We were interested in trying to understand whether there are some parents, if they're not given antibiotics, don't trust the first answer that they're given if their provider doesn't recommend antibiotics, but it seems like that's probably relatively uncommon. And then we asked about where people seek care if their child has a bad cough and fever, and about 3/4 said that they would go to their primary care provider. And there were others who said that they would go to urgent care, emergency department, a pharmacy, or somewhere else. So in conclusion, most Vermont parents report using a full course of antibiotics for their children. Rates of expecting antibiotics for symptoms likely caused by viruses, such as runny nose or cough, were relatively low, which is good. And rates of expecting a test or antibiotics for painful urination were kind of lower than we expected, because as we mentioned in some of the earlier slides, urinary tract infection is generally caused by bacteria, and so a test and antibiotics are typically warranted for urinary tract infection. And with that, I will turn it over to Dr. Revlin.
Thank you. So what I'll be talking about is some analysis that we did on Post to Baby Center, which is an online parenting forum. If you are familiar with things like Facebook or Reddit, it's sort of like that, but more targeted towards parents or expecting parents. But the structure of having posts and comments and things like that is kind of what it looks like. And the reason that we wanted to do that is the survey that we did was really nice because it was very targeted. We could ask specific questions to people and get some information. But one gap in the literature is that, you know, when you ask these questions to people, sometimes there can be a little bit of bias where people kind of tell you what you want to hear. And looking at how people naturally communicate sometimes can give you a little bit more insight onto how things work in the real world, or what happens when the rubber hits the road. And so we wanted to look at these posts on Baby Center to see how parents were talking about antibiotic use in sort of a natural context. So what we did was we scraped public posts and comments relevant to antibiotic use from the Baby Center United States social media site. And so these were all in English, and it was through the US-based site. There are sites baby center versions that are in other countries, but we focused on the US posts. And the way that we identified the posts that we were pulling is using those symptoms that Dr. Nowak talked about earlier to sort of target when people were talking about different things that were happening with their kids, and then looked for indications of specific words around those symptoms, as well as things like antibiotic and like specific names for antibiotics. So we pulled these sites. We ended up getting 726 posts and 5,227 comments, which we analyzed qualitatively. So what that means is we read all of the comments and posts and identified themes of what was happening. So the themes were centered around individual factors, so things having to do with that particular person, interpersonal factors, which centers around things between that person and somebody else, or structural factors, so things that had to do with the healthcare system or insurance or just the system at large. Not every comment got a code, because sometimes the things that they were talking about only incidentally referred to antibiotics. So they could be talking about, like, you know, somebody with an ear infection who then, you know, broke their arm falling off a tree or something like that and had to go to the emergency room. And so really the post is about going to the emergency room about your broken arm. It's not about the antibiotic use. So not everything necessarily got coded. But we did see some good communication around questions and concerns around antibiotic use within our different themes and factors. So starting with individual factors, again, that's sort of factors within a particular person. Those kinds of things really centered around knowledge and beliefs. And I know that there's been a lot of talk now about misinformation, and I think that's certainly present where, you know, not everybody necessarily understands when to use antibiotics appropriately, or maybe has some beliefs about antibiotics that aren't scientifically credible. So that was out there, but it was not as prevalent as one might expect given the news. Most people did post about appropriate antibiotic usage, and some of that might have been in response to misinformation where people were correcting the record. So that was really nice to see. Most of the perception, it seemed, from these posts were that antibiotics were safe and effective, even for babies. Although a lot of people got more concerned and wanted reassurance when it was sort of pregnant women or really, really little babies. They wanted to make sure that they were doing the right thing. There was some hesitance around using antibiotics. I think there was sort of a thread about, you know, these are safe and effective, but like we want to avoid them if we can. And so some of that led to recommendations for alternative treatments or over-the-counter remedies. And sometimes we saw that in co-occurrence with antibiotic use. So if you're going to take antibiotics, also make sure that you're eating yogurt or something like that, or you know, try cranberry juice first, and if that doesn't work, then, you know, you can take the antibiotics. So that was sort of interesting to see that co-occurrence. Thinking about interpersonal factors, I think, again, this is sort of the interaction between different people. And this was a really big theme that came through, that a lot of the people who are posting on these forums sometimes lacked support in real life. And that's kind of how they got onto the forum, whether that's, you know, they're the first person in their friend group to have kids, or, you know, they don't live nearby their family or friends, or they're just feeling unsupported or unsure. They were sort of reaching out to other people. And I think sometimes that also came through in terms of their providers, where they didn't feel like the provider, there was sometimes a sense that the provider thought that they were like getting hysterical or like asking too many questions. And so women felt, or parents felt, unsupported. They, you know, would ask a question and the provider would sort of brush them off and say like, oh, you don't need to worry about that, rather than explaining what was going on. So a lot of people sort of felt this interpersonal lack of, respecting their questions, and just felt this need for more information and more support in what they were doing. Parenting is really hard, and so having some validation that you're doing the right thing can be really useful. And a lot of the folks on this forum mentioned that they weren't necessarily getting that support. And so again, the lack of attention from providers, whether that was, fully answering a question or being able to access an appointment that was maybe long enough to answer the question, was a big theme in the forum. There were also structural factors that came up in the forum, things like access to care, and being able to afford treatments. These certainly arose, but weren't necessarily huge themes on the forums. And I think that might have been due to some not wanting to necessarily share like how hard off you are. Even though this is sort of a anonymous forum, not everyone feels comfortable sharing that they are struggling financially, or that you bypassed giving your kids medication to do something else. So there might have been some bias in terms of what we saw regarding structural factors. So I think overall, it was a really interesting way to identify what's going on with parents and really see what are the factors that impact their use of antibiotics in an appropriate way. And largely, I think it fell to this interpersonal stuff of needing support and needing, wanting somebody to tell you what to do and tell you that you're doing the right thing. So people may sort of know what antibiotic appropriate use looks like, but they want to make sure that they're doing it right, and they want that validation, and they want an explanation from their healthcare providers. And so those are some directions for future policy work or future research, is really understanding how we can deliver that and do that in a systematic way in our healthcare system. So thanks.
Thanks. Well, thank you all for watching, and we'll put some information about how to contact us in case you have any feedback or questions in the notes. Thank you.